Hello, this is Michael P. Sill from Phoenix, Arizona, USA. And I'm going to be talking about now for the medical e-learning lecture here, short little topic about stress testing. What is stress testing? Well, stress testing is where the cardiologist wants to assess how your heart works in a graduated, stressful environment. And the way to mimic that, to see if you've been complaining about chest pain or shortness of breath when you're exercising, walking or running or having some sort of physical activity, one way they can do that is on the treadmill. And most people are familiar with the treadmill. They've walked on them on the gym, so they know what it's like to do that, or on a bicycle, a stationary bicycle. But the treadmill is the most common that's used in the medical field if you're able to walk on a treadmill. If you can't walk on a treadmill, then they can do a stationary bicycle stress test too. So basically what it is we hook up 10 wires on your chest. Now on the male, sometimes we have to shave the hair off the chest to place the electrodes on there. And then we put these sticky patches on there, and it hooks into a component of the treadmill stress package. And it allows us to look at a full ECG, a 12-lead electrocardiogram on you. So you're able to see from all the different views what the electrical activity of the heart is doing. And basically with a stress testing, they start out, there's different protocols they can do. They can have the treadmill at 0 elevation and a very low speed of 1 mile an hour, or they can start out at 1.7 miles an hour and a 10% grade. And then every 3 minutes, they increase it up to 2.4 to 12%, 14%, and so on. Usually a stress test, usually on a healthy person, normal person that is asymptomatic, I can usually do, 6 to 9 minutes. Some of your athletes can go 12, 15 minutes. So when you start getting up into those areas, it's pretty fast that the treadmill's running and it's pretty high elevation. But normally what it is, you try to obtain a goal of a certain heart rate, 100% to 85%. And the figure they use for that is it's 220 minus your age, and then 100% of that, and then you take 85% of that for your 65, 70% maximum to go from. So it just depends on how you're able to do it. You're monitored throughout the whole stress test. You're actually having your blood pressure taken. ECG strips are run. The cardiologist is reviewing that in real time. The cardiovascular technicians or stress technicians are there monitoring what's going on with you, encouraging you to go, telling you when the different stages are going to happen, so the speed will be increasing and the elevation will be increasing. So it's an effort that everybody's done. For patient safety, we're constantly watching and monitoring the patient to make sure that they're okay. When the test is done, they'll stop the treadmill rather abruptly, put you onto a bed to lay down, and then they'll do 6 to 8 minutes of post-recovery to see how well your heart responds coming back to a resting mode. So again, they'll be monitoring your blood pressure and the EKG and looking at everything that's going on. So that gives you a little insight of what stress testing is done. Thank you very much.